This conference will now be recorded.
So once again, welcome everybody from wherever you are around the world. We're very excited to have you guys here today at Onyfix 2.0, which is advanced training for existing certified users. As a reminder, this is not a basic or initial training. Only you guys are here because you have already been certified and taken the original class. So we're not going to go over basics. We're going to talk about a couple of awesome new techniques, uses basically, that we've discovered for Onyfix since we've launched the line. And we're also going to talk about some advanced troubleshooting techniques as well, just to refine your techniques, give you guys some additional pointers and guidance on how to optimize your client applications and client outcomes. At the very, very end of the presentation, I will take questions. You can type them into the chat box if you'd like in the meantime. Otherwise, we just wait until the very end until we have a chance to address them. So for those of you that don't know me, and I think that there are a number of you that don't, my name is Martha Popella. I'm the Director of North American Operations for Neuberg Healthcare, obviously our North American division of Neuberg Pharma in Germany. And from the past, those of my professional endeavors in the past include, I'm also an infection control specialist and a compression therapy specialist. So if you've ever taken one of my other courses in the past, then that's me, and I continue to involve in my much loved career. So welcome everybody. As we get rolling, before we get started officially, just a quick little note here. We've got this great new exclusive and private Facebook support group for Onyfix professionals. So if you've been certified, you're an existing user, and you're having some, troubleshooting techniques that you're not too sure about, or something's kind of not, you're not too sure, you have questions, or you have awesome case studies to share, some really great before and after pics, we highly, highly encourage you to take advantage. You can join our Facebook group. There's the link at the bottom. I will ask my colleague to pop the link into the chat box for anybody that would like to join. We do highly encourage you. It's a great learning experience and has really helped a lot of you to refine your skills already to this point. So welcome to that as well. And without further ado, let's get rolling on to Onyfix 2.0. So this is the great thing, guys. This is the number one thing I want you to take from this webinar tonight. Whatever you thought you knew about Onyfix, forget it, throw it out the window. It is so much more and so much better than we ever thought it was. It's so much more than just originally we thought that it was primarily just for ingrown and involuted nails. So it's now the only universal all-in-one nail correction system for a wide spectrum of nail problems. As a result of that, it applies to, there is something that can be used for, Onyfix can be used for within any and all levels of the foot care or foot wellness industry. So we're very, very excited about that. So let's take a quick look here at what makes Onyfix such an awesome universal nail correction system, unlike anything that has ever been seen before. We've got obviously the original ingrown and involuted nails, so transverse over curvature, tongue twister, and unguous incarnatus, and pincer nails, which is of course severe transverse over curvature. We often get asked that, does it work on pincer nails? Absolutely it does. In fact, if anything, that's where Onyfix shines. That's one of the places it really shines the most. Onyfix loves thick, badly involuted, trumpet spirally nails. It just does a really fantastic transformative job on that. Okay, onycholytic nails, detached nails, guys. This is one of our exciting new things that hasn't really been talked about a lot. So I'm going to give you some details on that coming up. We've got split nails, which is really fun and exciting, both horizontal and vertical. So onychorexic and onychoschitic, relatively speaking, to each accordingly. So we'll talk about that coming up as well. Pedaloid accessory nails. That's a really sort of I guess a more rare genetic disorder, but common enough that enough people come with it to foot care professionals with complaints. So we can help with that as well. There is, of course, acute and chronic pain, which is, a really, really major one. One of the things that your clients look to you for the most, which is sometimes what lands them in your office to begin with or in your business. We've got nail restoration and nail reconstruction, two very distinct and separate and exciting new applications. Nail restoration, I can't wait to talk to you about that. That's just for generally talking about unhealthy nails, and we'll have an example of that. So versus reconstruction, which is a rebuild of broken, partial, cracked types of nails. So we'll look at those. And of course, for those of us in the medical industry, as a surgical adjunct for both PNA or partial nail avulsions, both unilateral and bilateral, as well as total nail avulsions without matrixectomy, of course. So with that said, as a reminder then, that which you thought you knew about Onyfix in the past, forget it, throw it out the window. It is now the only all-in-one universal nail correction system available in the world, and surpasses the needs and abilities of all other non-surgical corrective methods and devices, makes other methods and devices obsolete, which is really exciting. You now have one system that can do it all, that can significantly help your clients and your practice, as well as your business. So let's take a quick look here. This is just the general working principle. I'm not going to spend too much time on this because most of you already know this, but I'm going to remind you that this was the original classic application, that Onyfix was originally started, and certainly still is, but has evolved from this as a non-tension based system. It is the fact that it doesn't require tension or tightening or loosening in any kind of flexible way in order to work. And so there's no risk compared to those traditional bracing methods. It overcomes the problems with over tightening, say wire braces and plastic braces and some of those other old types of methods now. You can over tighten and accidentally lift the nail too much off the nail bed, cause onycholysis and cause damage to the tissues. That's not good. That's a high risk thing. Sometimes you're not too sure, you under tighten it, it can get loose. They require frequent adjustments and so on with the wires and things like this. So it's not convenient. Of course, you use what you like, but we're all here because we've seen how Onyfix can overcome those challenges. And so our traditional application was that you would apply a proximal strip, one full strip at that proximal end, allow it to slowly grow off, and it doesn't require tension. It freezes the nail in that existing nail shape, and all of the new growth behind the strip forces the nail to grow out in a straightward striation. All the new nail fibers become straight. And there's a way in which the Onyfix bonds with the nail plate and forces it to grow out in an immobilized fashion that is not tension-based, that works in a superior way to really help those nails become corrected over long amounts of time. Now, it also helps other things that we're going to look at, like not just ingrown and involuted nails, but these onycholytic, fibrous types of, thickened nails and so on. So we're going to take a look at that. Ultimately, then, Onyfix, whatever your reason for the application, it does help for the nail plate to form a better and healthier relationship with its underlying nail bed. So you're helping to restore nail health overall, regardless of the application. And we, of course, in turn see better, healthier tissue with better improved blood flow and, nerve function and less risk for things like cut circulation and nerve damage in the long run. And of course, depending on the need for the use or the severity of the condition that you're looking at, you may use from 2 to 4 growth cycles as necessary, but we typically find 2 to 3 growth cycles can do even some of the severe cases. So your client is in your chair, and how do you assess where to even start? You've got the choice of 2. This is where you kind of have to veer. Okay, how do I decide Onyfix hard or Onyfix soft? Basically, this is one thing that I feel that there hasn't been enough emphasis on, and part of why we're here today. Onyfix hard typically, classically, has been far more in use. I would say that 80% of cases up until now have been Onyfix hard. Those are for the thicker, harder, more gryphotic nails, if you will. The Onyfix soft then would be your other choice for the smaller, thinner, more flexible nails. But what we're finding is that the Onyfix soft is your new best friend. It's the soft, guys, is the new go-to, and that's because we've discovered it's a bit hard to judge all the time exactly how flexible the nail is. That's really your deciding factor about which viscosity to use. The hard is kind of more like a putty or a Play-Doh or plasticine kind of thing, and the soft is more like a liquidy version. And so we're finding that the defining decision, the thing that makes you decide which of the viscosities to use, is how flexible the nail is, not necessarily just how thin or delicate. So we're teaching now that if you're even at that cusp or you're not too sure, forget the hard, go for the soft. It's going to solve a lot or help avoid a lot of problems in the future, in particular early fall-offs. Now, don't get me wrong, the hard is still going to be your main go-to. Don't forget, Onyfix hard loves the thicker gryphotic nails. It really shines with pincer nails. But for other applications and for those kind of, I'm not too sure how flexible that nail is, or I've had an unexpected early fall off, we strongly recommend do the soft, nip it in the bud, skip the hard altogether and go right to the soft. So classically then, there are 5 types of applications that we typically teach. On the left-hand side here of the screen, we've got the Onyfix hard, because we're now dividing the types into the 2 viscosities, the 2 types of tubes that we have. So you've got your classic full strip at the proximal end and your half strip at the distal end. So remember, your classic full strip is going to be most of your cases your most common go-to. It can be used for anything from ingrown, involuted, onycholytic, those detached nails, split nails, including those PNAs, as well as a restoration of nail health. Now, the half strip, guys, it's only really necessary. The half strip at the distal end is really only for immediate pain relief from ingrown and involuted nails. And as a PNA adjunct, we're going to talk about that for you guys in the medical industry. But it's really important that you set your patient expectations, that the half strip is temporary and meant to fall off sooner rather than later. It might only last a week or 2, it might last a month or more, but it's already nearing its the edge of its growth, the free edge of the nail, so it won't last, and it's not meant to last. And that's okay. Just make sure that you set your client expectations so they don't feel upset that it fell off and they're like, oh, Onyfix doesn't work. And yeah, no, it does. Trust me, it did its pain relief part, or in the case of PNA, its initial sort of a growth liftoff, which we'll talk about. Now, on the right-hand side, we have the Onyfix soft then. So these are your typical 3 applications that you would use the soft for. We've got the same like the hard, we've got a proximal full strip at the end, but this one is a single layer of soft rather than in the middle we have the double layer. The single layer, it's pretty intuitive. You would use just 1 layer on really smaller, delicate nails, the thin nails, the little ones, but the larger hallux nails or stronger nails, you can and should use a double layer. And that double layer gives the strip a greater strength, more structural integrity so that it lasts longer. It's more robust and can withstand many weeks and months of wear. The last one here, we've got the whole nail application. So typically, again, you would do a double layer of the whole nail But if it's really just a little toe, a tiny toe, a child's toe, or fourth or fifth toe, usually just a single layer on that whole nail is fine. And we're going to talk about some of the different applications where you might need to use these 5 application types differentially based on the cases. So moving forward, let's take a look at some of the additional new uses we found in both non-surgical and surgical applications that hasn't really been focused on in the original training classes, if at all. So the first one is one of my favorites, onycholysis, or detached nails. I love how Onyfix can really solve the problem. It fixes the problem, guys. And historically, just like we have not properly had for ingrown and involuted nails, we haven't had a medical level but non-surgical option for something like onycholysis. If it was really kind of a bad case, a lot of times if you ended up in a podiatry or chiropody office, the best advice to the patient would be to remove the nail surgically entirely and let the new nail grow out properly fused with the nail bed. But now you don't have to, your clients don't want surgery. I assure you they don't. 99% of them basically would wish to at least know what options there are other than surgical methods, if possible. People are afraid of needles, they don't like the pain, they don't have the money, the list goes on, right? And so surgery really is a last resort. And so enter Onyfix, you can now solve that problem with really one of the simplest applications I could possibly hope for, which is Onyfix. You can slap on that. We typically recommend the soft. So what you would do, first of all, trim the nail back right to the edge of where it's connected. So remove as much of the lifted or detached nail as you can, and then in the amount that's remaining, unless there really is there's so little left, you may want to invite the patient back or the client back in a few weeks' time to allow a little bit more growth. But usually there's definitely enough to attach right away while they're there in the office that day. Would you recommend the soft? And that's because when there's that little nail left, we find that it's kind of better and easier coverage with the soft. It kind of spreads out better. And typically a double layer is usually best. But again, it's your discretion. If you find that the nail is very small, despite being detached, then you can use a single layer. And then, invite them back in roughly about 3-4 months or even 6 months, depending, right, however your appointment schedule works, but somewhere between that 3 to 6 month mark to check on it. And if enough has grown of the new nail that it's about roughly 2/3 of that original strip is about 2/3 of the way up, then you can even for good measure apply a second strip for them. At this point, because there's a lot of new healthy nail available for you, you can choose whether you want to do the soft or now this time the hard, again, depending on the nail flexibility and the size of the nail and so on. And so we're thrilled to see many cases of Onyfix helping the nail plate to fuse back properly with the nail bed and solve the problem for those patients without surgical intervention. Another non-surgical use here is for split nails. So we've got vertical splits or onycholytic nails and horizontal splits or onychoschitic nails. So for vertical nails, there's a bit of a misconception, guys, about how to apply Onyfix correctly for vertical splits. You kind of tend to think intuitively, okay, I'm going to put it vertically down along, I'm going to apply this Onyfix along the length of the crack, the split, but that's actually incorrect because you're not preventing the medial and lateral edges of that nail, but both sides of it, from being properly immobilized. You want to actually just apply a classic strip at the proximal and a horizontal strip at the proximal end to really act almost like a little nail cast. And so that you can let that grow off. What we do recommend specifically for vertical split nails is that a really good idea, a strong recommendation, is to apply a second full strip about half or 2/3 up the length of the nail as well. That just helps to reinforce it more strongly, to prevent that nail from constantly bending, back and forth and exacerbating the split in the center. So you're really going to hold it all nicely together. Let that grow off, and in many cases it fixes the problem. For horizontal splits, this one might be a little bit trickier. It depends on the cause. As long as it's not a case of, say, a very brittle nail syndrome, which is a bit different. Very highly brittle nails is the one thing that Onyfix and any other type of a system doesn't adhere well to. That's just normal. It's just physics. It's basically like trying to apply Onyfix onto a bed of sand. The sand, it's going to be like crinkly and loose underneath. It's not going to bond well. We're aware of that. Please be aware of that for yourselves too. If it's really terribly brittle, like I'm talking fine, fine pieces, if you will, almost, then Onyfix, you can try it and it will work, but it's going to take multiple applications because you're going to see fall-offs sooner rather than later. But we've learned that even patients with brittle nails would still prefer to give Onyfix a try rather than suffer with some of the conditions that they have, provided that you have set the expectation that they know that on their particular unique nail, it will fall off a little bit sooner, so you're going to have to see them sooner and reapply more often. But quickly now, the horizontal split, I didn't finish describing those, but that one, same thing. You can technically do a full proximal strip, but really we find that whole nail applications are a good way to go for that kind of, because it kind of holds the whole nail in together, and you can let that grow off. Now, before I forget, let's say you do apply a full nail application. As that nail grows off, because you should regularly monitor that patient's nail growth just for maintenance. So when they come back for monitoring and maintenance, you have the option of that space, that gap behind the whole nail, the original Onyfix whole nail. And the gap behind it, you can fill it back in with Onyfix Soft, with more of it, and level it out, and that gives them extra longevity for their treatment. And for the front edge of that the part that's growing off, you can take a ceramic burr and just gently trim it down. Don't use carbides. They are way too coarse and rough. Carbide burrs will, or carbide bits or burrs, whatever you want to call them, do take off too much. They're way too coarse. And diamond burrs are not good either for trying to trim down Onyfix applications, because they're usually a bit too fine. They're going to damage your burr, and it'll strip the grit off way too early, so it's just a waste. And in any case, we find that the fine dust of the Onyfix that gets into the grit, it has a harder tendency to get cleaned out correctly, and that can cause disinfection and sterility issues. So we recommend only the ceramic burrs for trimming back growing Onyfix strips or whole nails. So continuing on here, another great non-surgical use, albeit rare, but always nice to be able to share experiences and case studies with our network of colleagues. We've got pedaloid nails, and this is also, we would have the same sort of application here for onycholytic or vertical split nails. We've kind of already covered that, but it's just a mention that they're very, very similar, at least in terms of the way that they initially look. But what pedaloid nails are, and as they differ from classic split nails, is that they only affect the little baby fifth toe, the toenail, and it's literally like a sixth nail that's adjacent to the proper whole fifth baby nail. And it's a genetic condition. It gets inherited through families and so on. And classically, we've basically just told patients, you've got to just surgically remove that little annoying piece of appendage fifth or sixth nail, really. But there's no need to do that if they want to at least try Onyfix. And in this case, we would recommend the soft, and do a whole nail application. It's like little baby nails. You're never going to get the hard on properly. A single layer is absolutely fine. Same thing. Don't forget to roughen the nail underneath and prime it as you normally would, and then just a single layer of soft is fine. And again, every patient is different, but this particular case has now lasted for over 2 years, where that beautifully refused nails, the two nails fused together, it has grown and it has lasted this long. So it's nice to at least have that non-surgical option. All right, now for another non-surgical use that hasn't been discussed in any of the original classes. Nail restoration. This is my new favorite use for Onyfix. I love this, and I want everyone to pay good attention to this section here, because it applies to everybody in the foot wellness industry. It doesn't matter whether you're a chiropodist, podiatrist, foot nurse, nail tech, so on, right? If you touch feet, this application applies to you. You're going to have clients that have, we'll call them ugly nails, just to sort of keep it simple, right? And it's a case where you've generally damaged and unhealthy nails that from years of long-term, neglect and poor maintenance and abuse, and like podiatry visits that have had to cut out pieces and corners and slivers and so on, and the nail kind of just doesn't really grow back healthily or normally anymore. And we can significantly restore the health of that really awful nail. It's amazing. It doesn't, even if you're not sure what the diagnosis is, and we're conscious that diagnosing isn't even in the scope of practice for all foot wellness professionals, that doesn't matter as long as you have a nail that presents a generally unhealthy condition, provided it's not infected and oozing and has other sort of red flags where it should be referred to a podiatry or chiropody clinic. As long as it's not an acute condition, you may certainly try Onyfix as almost like a type of benign first start to see if it helps, and most likely it will. Give that, you would apply a proximal strip, usually typically your hard at the proximal end. See how that goes. If it's really growing out beautifully in behind, then you've solved your problem. If there are still continued issues, then certainly you can and should refer to a podiatry clinic or chiropody clinic. But the point is that in terms of both restoration of nail health as well as restoration of aesthetic appeal, Onyfix is your #1 go-to now. Look at the transformative difference in even as little as 4 months. Again, everyone's rate of nail growth is different. It's individual, no problem, we get that. But, give it that one, slap the Onyfix on, let it grow out, see what happens, and take it from there. As a result of this phenomenal new universal nail restoration application, we can now also help prevent the need to remove the nail entirely, because again, historically, in a medical setting, that's usually the last resort. Once it's chopped and sliced and diced and it looks just awful, and you can't, years of growing in the same way has created this chronic condition. You can avoid the surgical removal and give Onyfix a try and see what you can do in a very easy and non-risk type of fashion. By the way, of course, I think it goes without saying that when you do restore the nail health, you can and you should look at this, especially if you have clients at risk for this kind of stuff. You can help prevent further complications of those unhealthy fibrous thickened nails and stuff, such as helping to prevent infections like particularly onychomycosis, onycholysis, the detached nails, but further ingrown, involuted nails, and so on. Now, one quick little side note, guys, before we go on to the next slide, as it relates to nail restoration of general nail health, we are very, very excited to share with you Anecdotally, at this time, we're just letting you know we're sharing our feedback and experiences from the users in the world with you, that Onyfix has shown to help with certain cases of onychomycosis, certain cases of fungal nail infections. Now, we're still looking into it to make sure we better understand what's happening. And to be able to, sort of apply it in a way that makes sort of sense for everybody. So, but while we study it, we thought it was exciting news to share that we have seen many cases now from users in the industry, anecdotally, that after an Onyfix application, it cleared up onychomycosis cases, even those that have been chronically persistent for years and years and years. So very interesting note to keep in your mind. Again, even if you're in the part of the industry where it's not typically within your scope to diagnose and treat onychomycotic nails, don't worry about that. Remember that you're giving it a try for restoration of nail health first, and if it doesn't clear up, you should be referring medically accordingly. So great to know on that side. One more here, we've got the reconstruction category now. So nail reconstruction is to be differentiated from nail restoration of nail health. Reconstruction is really for rebuilding those like broken, cracked, damaged, and partial nails. You would see this typically more in the aesthetics industry, but not always. We have to be fair. We have lots of clients presenting to us from the general public with all different types of foot, or in this case, hand problems. Those of you in the sort of, I guess, aesthetics and nursing industries can treat and work with hands as well. So it's just good to know, to keep this in mind, that it's not just for feet. And that what we love about this is that you can help rebuild a whole nail over top, or to help replace missing and damaged nails. What we've learned is that you typically need about 15 to 20% of the original nail plate to be present in order for the Onyfix to bond to something. You need something, because it's not going to bond well to skin, or it won't. It will bond to skin temporarily, but not for long. So we originally were saying, don't apply the primer to the skin. And we're going to talk about one specific case next. If you can apply the primer to the skin, with the distinct exception that there are no cracks or breaks or openings. Just be responsible, right? Don't put any type of liquidy stuff or composites into broken skin. But as long as you use your common sense on that point, and it's all nice, the skin is nice and strong and closed over with no cracks or breaks, and then you may attempt a reconstruction. And so you would, prep that tiny little bit, that little nub of nail. Just give it a tiny little bit of a roughing to give it a rougher surface for the coming primer and composites, and then use your Onyfix Soft to fill it, to create a whole synthetic nail. You would cure that, and then you could refine it at the end like you normally would. We found that this can last, and again, it depends on the condition, and there are different factors, but it can last for as little as maybe 4 to 5 days. Which is, by the way, for those of you who are not familiar, a phenomenal amount of time for some people that really struggle with nail development. And as many as, up to 12 weeks we've had a record of, which is amazing. Please, again, set your client expectations. These ones will fall off sooner than, your classic Onyfix strips, because there's not that much nail to begin with. But as the new nail grows back in, it will create more base. You should be inviting the client to come back to backfill with Onyfix Soft and behind it. And again, as a reminder, trim down the growing out part with their ceramic burr. Lastly, just a reminder then, For those of you who are doing nail reconstruction, we highly recommend that you send the client home with a PhotoExpert nail tincture spray to help keep the nail and the underneath of the bed sanitized and clean and fresh. Instruct them to wash it regularly, not too roughly because they might lift it off, but gently. And then that PhotoExpert nail tincture spray, which has pyroxenolamine, by the way, and that's a compound that has both antifungal and antibacterial properties. So pyroxenolamine is a broad spectrum type of sanitizing agent, and so that will help keep the nail and the nail under the area underneath and around healthy. Do keep it contained though to the nail area. If the client has athlete's foot or pedikeratolysis or other fungal and bacterial issues with the rest of the foot or skin, please do use the standard red label for PhotoExpert, the dry red and itching skin. That's for skin. The nail tincture is for nails. So, all right, moving on here. So this is related to the general reconstruction. It's just a very specific case study. We had an instance of a client with a very rare genetic condition called nail patella syndrome, which is where these poor kids they have, and once they turn into adults, they have a hard time. There's a sort of a genetic program that prevents their nails and certain bones in their bodies from forming properly. And so these are the we understand, especially young children, young girls in particular, not to stereotype, but certainly, the girls like to be, they have self-esteem. They like to look pretty or feel good about themselves in any case. And they love to be able to have the option of getting their nails filled in and redone. So although it's rare, you can look for this condition. And this is the one where we have historically seen that other types of nail rebuilding materials don't last for more than a few days tops. And so far on all of our tests, the Onyfix whole nail application has lasted the very longest out of anything. So absolutely keep this one in mind for those types of patients that have these conditions, and they can of course immediately afterwards apply their nail art and sparkles and nail polish, if you will. So no problem there. Again, just a reminder, if they are applying nail art, now that the Onyfix nail has been, rebuilt underneath, just deal with it gently. Don't over manipulate it because you might cause that nail, the synthetic Onyfix nail, to fall off earlier. So just take extra care with that one. All right. And now coming to our surgical application, which of course applies specifically to the medical industry here, but we encourage all of you to learn how this works because you can extrapolate that information, you can relate it in many different ways into your daily business so that you can, if nothing else, then know how to refer properly to medical clinics, to podiatry and chiropody clinics for assistance with this kind of thing. But what we love about it is that you can use it for both PNA, for unilateral and bilateral applications, as well as TNAs or total nail avulsions without matrixectomy. So on the left-hand side, what you could do then, so let's say this is one instance, for example, that we have a PNA that was done on a client with a very badly involuted and ingrown nail on that one side. In this case, it was a chiropodist. They removed a little sliver, that sliver, particular sliver of the involuted and ingrown part that was misshapen of the nail. And while the client is still there in the chair, provided that there's not too much, moisture like exited from the surgical extraction or the burning, you can immediately apply Onyfix. First you would do a full proximal strip at your classic strip at that proximal end, as well as, very important guys, a distal half strip. And both of these in combination are going to help prevent the leftover nail from involuting further and prevent the new nail growth from re-involuting and causing more problems, or growing back in slightly misshapen. How many times have we seen that nail after a fresh surgery still doesn't kind of quite grow in nicely. And again, remember, your patients have self-esteem. They generally want their nails to come back reasonably nice looking. So this is a very important application. Now, if you find that there's a lot of exudate and there's too much moisture, don't bother with it then. Don't put Onyfix on right away. Just wrap it up, bandage it up, and have the patient come back in about 1 to 2 weeks, maybe 2 weeks. Once that the fresh incisions have healed over nicely, and there's, it's not kind of oozing and potentially causing bonding issues with the Onyfix later. So we would encourage you again to invite them back roughly about 4 months, or roughly when that first strip has reached about the halfway to 2/3 mark, so that just for good measure, you can apply a second strip. You don't need to, but it is recommended just for extra, you want to kind of get the one full growth plus a bit to make sure it grows in nicely. Now, and the same thing applies whether it's a unilateral or bilateral. So if you take out both sides, same thing. If your patient is in the chair right there and it's not oozing too much, just be very, very careful not to get primer or Onyfix into the fresh incisions. But you can do it right there. If unsure, it's kind of oozy, don't worry about it. Call them back in a week or two, just so you should be checking bandages and infections and so on anyways, and you guys can apply it at that time. On the right-hand side here, then, that we have the TNA, so total nail avulsion, but without the matrixectomy. So of course, in this case, you're leaving the little, the baby nail cells intact. Just pull out the nail or avulse it or whatever it is that you do to surgically remove that, and then remove it, but then invite the patient back in roughly about 8 weeks, roughly 2 months, give or take, such that you have about 2 to 3 millimeters worth of new nail growth, so that you have enough space, enough nail to actually apply some Onyfix. We would, in this case, recommend using the soft. If you feel that it's a very large hallux and there's enough strong and wide nail to apply the hard, you can certainly do that. It's your discretion, but we do recommend the soft. We find that first bit responds better to soft. And again, we invite you to invite the patient back in a couple of months to check on it and put a second strip for good measure. This time, if there's enough healthy, thick nail, then you can apply the hard or the soft at your discretion. So that is a fabulous surgical addition to any podiatry or chiropody practice, especially if surgery is your primary thing. You need not fear that Onyfix doesn't have enough uses for you in your medical setting. Actually, if anything, I like to say that it's the medical folks that have the best luck, because they can use Onyfix for absolutely everything because it's within their scope. So now you have many new uses that you can add so that you can help more patients and drive that patient care, engine a little bit more, which is of course very healthy for your practice as well. So let's now move on to advanced troubleshooting techniques and guidance. What we're going to do is look at what ideal applications should really ideally look like, and then some additional troubleshooting guidance as we go along. So let's start with our classic hard proximal full strip. This is really a beautiful application here, and one that you guys kind of use as your meter stick, if you will, your frame of reference to measure whether you did something reasonably similar or not. And it should ideally be about 2 millimeters by 2 millimeters. I think most of us know that by now. And as a reminder, the tip over here, so the tip of your spatula is exactly 2 millimeters wide, or the stem of a Q-tip or a cotton-tipped applicator is also about 2 millimeters. So you can feel free to easily use that as your measuring guide as you go along. Now, the overall strip is important too that you understand. 2 millimeters width by 2 millimeters height is very important. The height is probably more important in terms of not causing discomfort by having what we call sausage toes. If your Onyfix strip is too thick, in height, it's going to be annoying for the patient. So do stick to 2 or just barely less than, but don't go too thin either. Then it becomes too thin and breaks more easily. So what you want is a perfectly smooth, even headband application, right? You don't want depressions in the top, you don't want ridges, you don't want uneven sides, you don't want the tips that at the end of each strip, you don't want the tips to be crooked and sliding into the sulcus tissue. That tissue bends up against it, touches it, and then it creates sharp points or kind of sharp bladey edges. You should be very careful to round those up and lift them a little bit away from the sulcus edges to help prevent that squishing before you harden it. One good quick little tip or trick that I can pass along to you guys, thanks to our partners in the UK at Only Foot Care. Brenda Griffin had mentioned this when she teaches, and I like it. So if you're not aware of this trick, it's a good one to pass along. We're going to talk about it in a little bit more coming up, but it's really important that when you're applying Onyfix, you pull back the tissue edges as much as you can. And so one way that you can achieve that, let's pretend this is the tip of your toe, you can take Me-Pour tape or similar type of strapping tape and start tape the one side on this one and do like a crazy, or figure 8, start like this, figure 8 around the heel, back around the center of the foot here, the arch, and then on the other side, and tape it to the other edge. And that kind of almost like forces it to stay back while you do your treatment. So a good little tip to pass along there. The other thing here, I've kind of sort of written this twice, but I can't emphasize it enough because it really helps. You would like the strip to be applied in a straight arch or a vertical arch and not a horizontal C. Let me explain. I even made a little rudimentary cutout to help me describe this phenomenon. We find that oftentimes people will, imagine this is your nail plate. Users will create like a flat, almost U-shaped or C-shaped, but that's the wrong orientation, because as that patient or client puts pressure on their feet, it's going to start doing this and lifting, and in these corners, it's going to start to break and the tips will break off. So instead of like a C shape, you want to do a nice, perfect vertical arch, okay? Same thing, okay, so the tips are bulbous. Strip isn't too close to the cuticle or the sulcus edges. We already talked about the side tissues, not to touch there, but the cuticle is just as important, because if the Onyfix is bonded or near skin, the skin oils will get under it, especially at the time of bonding, if they're touching while they're at the time that you're curing it, and it will cause early fall-offs. And so if you're quite close to the cuticle and you need more space, remember in the medical industry, we recommend not to cut cuticles. So just, if you need more space, just gently push those cuticles back, and then you can have a bit more room. You can grab more surface area of the nail, if you will, which will help correct it, a bit more optimally. And so, okay, good. So next slide here then, that was our ideal full strip application. Now for our ideal distal half strip. So guys, in the past, we've typically had a couple of different applications that have gone around. I put all 4 here to help give you a visual. And really, guys, it's up to you which one you want to use most. They all work basically the same way. Remember that really the only purpose of the distal half strip for the most part is just immediate pain relief. And if it's a fresh nail avulsion on the side, then the point is to prevent that medial edge or lateral edge from jabbing back into that freshly cut tissue. So it doesn't matter too much which one you do, primarily because don't forget that the half strip is intended to only stay for a week or two, a few weeks, right? And again, set your expectations, make sure your patients and clients know that, so that they're not thinking, oh, Onyfix fell off too early, it it doesn't work. And it's like, no, it does work, but it's supposed to do that, you know? So we've got your classic straight strip over here. That's the one that was originally taught. You can absolutely feel free to do that. We recommend that you apply that at the corner, if you will, where the tissue meets that edge of the nail. And so that would be your good starting point. That will give it a little bit of growth left before it actually reaches the edge of the nail. And you've got curved and angled, which are virtually an identical concept. You would start your application at that joining point here on the curve and on the corner of where the tissue and nail begin to join, and just kind of follow the free edge curve or angle up the nail. Curve then would be probably used more for fresh PNAs or a fresh wedge resection, if any of you guys are doing those. But the angled one then would be more for you haven't done any slicing and dicing to the nail, so you can kind of just follow that whole corner, and it tends to kind of have more surface area coverage if it's following the actual nail shape. The last one here, we have our T-strip, courtesy of the invention of Tom Fisher, who put this together. And the idea is that you have a bit of a T-bar along the length of that edge that is in pain or has been freshly cut, with your T crossing here, and that T-bar at the top tends to kind of grab more surface area of the nail, supported by the little tail, so it can help sort of cover more surface area and prevent jabbing into the sides. So just a heads up on what the different options are, why you might want to use different ones, and understanding ultimately that any one or the other are pretty much acceptable. It's up to you, whatever you find easier or faster or whatever, okay? Now, the ideal application for Onyfix Soft, we've got, remember, your classic full strip in either a single or a double layer, so first and second pictures here, and the whole nail application here on the right-hand side of the screen. And so remember, for your your single layer, these are just for your little nails. Your double strip is for larger, thicker nails. And your whole nail is, now you've seen a variety of applications. Again, single layer for just little toenails, and a double layer for bigger and certainly hallux nails. Now, one thing to just, again, a little bit of a tip. When we say double layer, first of all, you're going to prime, like roughen and prime your nail the same way that you would for any Onyfix application. If it's a single layer strip, whether it's a single strip or a whole nail single, the point is apply that first, harden it, wipe off the residue, and then apply a second layer over the first hardened strip. I've had some misconceptions of people going, oh, does that mean I have to, I apply the soft and then I try to glob on more on top of the first layer? No, that'll just all run into each other and create a big mess. You do harden the first strip or the first layer and then apply your second. Don't forget, of course, the Onyfix is a little bit runny, so you got to work quickly with it. Working quickly is key, but you can use your spatula to kind of, refine your edges and push it into the places that you want it. But we understand it can be a bit tricky, so that's what your ceramic burr is for. Just remember to kind of refine your edges. And a quick little tip, it's good to keep your Onyfix soft in the fridge when not in use. Don't worry, it's not required. It's just a nice, helpful tip if you happen to have access to a fridge in your clinic or business. The colder temperature makes the soft a little bit thicker as it's coming out, so it just makes it a little bit easier to work with. So a quick little tip there. Now, for applying your composite edges, okay, so let me explain the two types here. Of course, we've got our full strip and our half strip. What you want to do at so you've got your long strip, right? The tips of that strip. If it's a regular proximal full strip, you do want to keep those edges, those strip edges, a little bit bulbous, a little bit thicker, because you want the whole thickness of your strip to be as uniform as possible and slightly on the thicker side, because it has to last, right? Like you want it to be more robust. But if you're applying a half strip at the distal end. Originally, we were recommending, do taper it. We can still continue to recommend that you taper it right now. Just be careful not to taper those edges too thin. Otherwise, those edges will lift off the nail early, and they also tend to kind of crack and break. But we do still, nonetheless, recommend a little bit of tapering, a little bit of thinning out or flattening at the edges, because it makes it less cumbersome in the shoes for the client, especially since it's at the free edge of the nail and they're going to be feeling that part in their shoes a bit more. We're going to talk about gray zones in a second, but very important here, guys. This is a really great example of a thinned out, like the distal half strip was a little bit too thin, and I also had a gray zone. So let's talk about gray zones now. Guys, gray zones is a thing that we definitely didn't really talk much about, or if at all, in the original classes. You want to avoid gray zones at all costs. What gray zones are when you're roughing your nail plate, but you don't properly, thoroughly roughen all the way down into the sulcus edges. But don't get me wrong, be careful and don't nick the tissue. It's you've got to still do it carefully, but you want to go as far to the edge as you can on both sides, including as far to the cuticle, up to the cuticle that you can. The issue is that we've been saying is that, especially if you're in a bit of a hurry, if you're in a bit of a hurry and you have gray zones, the gray zones is where you have roughing in the center, and then as you go closer and closer to the edges, the roughing gets less and less and less until there's no roughing at all. And then if you apply your primer and you haven't reached all the way in, and if you're then applying your strip, and both the primer and or strip, either can have this issue, is crossing that gray zone from roughened to unroughened nail bed, the tips of your strip are not going to be bonded well to your nail plate. They are going to come off first. They're going to flip, and then you're probably going to have an early come off. So just a reminder then to carefully, again, you can use whatever technique you like. If you want to tape or hold, it doesn't matter, but do pull back the sulcus tissue, the tissue edges, to get proper roughing all the way to each side. And then of course, same thing, apply primer thoroughly all the way to the edges. It's better to have a little bit more primer on the side and then cut your Onyfix strip a little bit shorter of that primer edge, so that the composite itself never crosses from roughened to unroughened nail. Okay, so those are gray zones, guys. Burrs, we've touched a bit on this, but I'll just remind you then so that you are using the optimal methods. For roughing, we do recommend approximately a diamond burr or a medium coarse. They're more rare to find, but medium coarse does exist. But most importantly, everyone please listen to this. Don't over debride the nail. Onyfix loves thick, hard nails, and I understand why you might feel the need for other reasons to have to debride or thin out the nail. Because Onyfix doesn't like the thin, flexible nails. We recommend, if at all possible, for whatever reason, if you can avoid it, please do avoid over debriding, because then what you're doing is creating a very soft, flexible nail plate onto which, again, the Onyfix will have a harder time staying in the long term, because the nail underneath keeps wanting to do this. So very important, don't over debride if you can at all help it. And then also remember, so no carbide burrs or bits, and no fine burrs either. Fine diamond or other types of fine grits will only smooth the nail out more, and you do want some coarseness to it. Coarse burrs now are too much as well. You don't need that. Somewhere in the middle is perfect. As a reminder, ceramic burrs only for refinement. And here's a great little example of where the Onyfix slid into the side of that sulcus, that nail tissue, touched it. The user was not careful enough to sort of, this was actually one of the first applications ever that this person had done. So it was a good learning experience, but you can see clearly how having slid in wet in the uncured state, that Onyfix squished up, created a little point and a sharp bladey edge. You want to avoid that. So what you ideally should do with your spatula before you even harden the Onyfix, please do lift the edges and shape the ends to be a bit like round and smooth and slightly bulbous, and then cure. If you find, particularly with the soft, we get it, if you find with the soft that there was some running into the edges, that is what your ceramic burr is for. You can refine those. Next thing, very, very important, guys, for those of you using water drills, you can't use the water function immediately prior to an Onyfix application. The wet nail will compromise the bond of the Onyfix immediately after. If you can, avoid the use of the water function completely. If you can't avoid the use for whatever reason, then one good trick to do is to clean the nail off after you've done whatever beforehand prep stuff you need to do. Use alcohol, because alcohol is very volatile, so it's going to help dry the nail out faster. And then use some like paper towels or something to really sop up as much as you can. And you're going to have to give it a minimum of like 5, maybe even 10 minutes before you can do anything else on it. Hopefully you can do it in just 5. You have to judge for yourself. But the nail plate must be bone dry. If it's not, go see another client or patient in the meantime. Just give it the few minutes to dry, and then you can return to it. But again, ideally, turn the water feature off. For those of you who aren't using nail drills of any kind at all, or e-files of any kind, you can use disposable nail files. Again, medium or coarse. If it's coarse, don't go nuts, right? Remember, you don't thin the nail out too much. Just take a little bit off just to create a nice rough surface. Do avoid the gray zones. And as a heads up, though, we are aware that the disposable nail files are a little bit, it's going to be a bit more work for you to refine the ceramic edges. It's going to be a bit rougher. If you can, we do highly, highly recommend the use of e-files and e-drills, but just be aware that you can still use Onyfix effectively with disposable nail files. Now, primer application. Very important. There's a misconception about how much Onyfix primer to use. It's believed, oh, more primer must be better. It's going to have a better bond, but actually it's not true. It's the opposite of that. The problem is that if you put too much primer on, this is what happens on the left-hand side of the picture. I've got little rudimentary pictographs here that I drew to help you visualize. This is your nail plate here at the bottom on a microscopic level, and those little spikes and mountains, that's your freshly roughened nail, right? If you then take your Q-tip or your cotton tip applicator with a drop of primer, and you don't need more than a drop, remember, don't put more, because now we're seeing that more is not better. If you put too much, you're going to overfill all of those nice, fresh, mountainous gaps that you just created. And you need those gaps in order for the composite to come on after and to really like bond, like Velcro, right, with the nail plate underneath, the roughened nail plate underneath. So a nice thin layer of primer is perfect. And then, just spread on. If you find that there's a bit of excess primer, particularly if it's a smaller nail and that one drop of primer really was way more than you needed, then just flip the Q-tip or your cotton tip applicator around, use the other end, and just kind of gently dab any excess that you've got, and you're good to go. Now, this relates to how we apply, Onyfix in terms of early follow-up. So great troubleshooting method here for you guys. If you are having trouble with early fall-offs, here's what we recommend. This is where, enter Onyfix Soft. Remember I was saying that We, even for a larger nail, we might have imagined that the Onyfix hard was the best way to go, and that is usually your default. But if you're finding that that nail is particularly finicky, then we highly recommend the use of the soft. The point where we are finding that Onyfix users now are using the soft and the hard, maybe in about 50 cases, or 60% in favor of Onyfix and only 40% for Onyfix. 60% for the soft and only 40% for the hard. So it's a great new, use all of a sudden for the soft, because we're finding it's working better for finicky nails. And the reason for that is this. Let's take a look at this again, a little sort of pictograph here on the right-hand side. It's just like what I showed you. You've got your nail plate here with the nice freshly mountainous ridges from the roughing you just created, with just a thin layer of primer. See how it's nice and thin under that. And then this darker yellow color over top is your soft. And there's something about the way that the liquidier soft fills in those gaps better than the hard does. And again, you don't need to worry about that too much if you've got nice, thick, graphotic types of pincer nails, but for the early fall-offs, we highly recommend trying the soft. And another thing, make your Onyfix soft strips, especially in these cases, a little bit wider, about 2.5 to 3 millimeters. 3 millimeters should be just perfect. Don't make them wider, because then they just become, again, kind of like wide and cumbersome, like a big, huge band. And certainly never make them higher. You never need to make them higher than 2 millimeters, because again, sausage toes, right? When nobody wants that discomfort in their shoes. But this is a great little troubleshooting tip if you're having finicky nails. So cleansing techniques, a quick little a few pointers here. Use only 70% alcohol, or we've had people ask, can we use 91 or 99%? Absolutely, you can. Doesn't matter, as long as it's pure alcohol and has no additives, and is not less than 70%. If you use less than 70, because there are, I think, 50% and 61 and 62%, no good. That's too much water, and that's going to make your nail wet. And then your bond is not going to be optimal. It's probably going to fall off early. So minimum 70%. Don't use acetone to clean your nails. Don't use any other cleansers. Everything, including acetone, they have additives in them that will compromise the bond of becoming Onyfix strip. Also, very important not to use any type of linting gauze or applicator. So use ideally non-linting, non-woven gauze sponges, which are available from every medical and beauty supply place on the planet. You can also use the little pre-packaged alcohol prep pads, because those are non-linting as well. And you can don't use like tissues, like facial tissues and paper towels and stuff, and definitely don't use cotton balls or even regular gauze, the regular woven gauze, because all of that stuff leaves little microscopic debris that you can't even see, and it gets trapped underneath your Onyfix, and then it's going to cause it to dislodge earlier. Also, for optimal results, it's not essential, but it's a nice optimization of your technique. After you apply your primer and after you apply any type of composite, whether one layer or two, after every time you cure a primer or a composite, wipe off the residue with an alcohol, a prep pad or what have you. And that's because the residue that gets left behind is kind of like, it's like debris. It's the stuff that couldn't polymerize or react chemically any further. And it kind of gets in the way, right? It's better if it's not there, so that the primer that's left behind, or the composite that's left behind that needs to have a second layer put on, is optimally dry and ready for the next layer, because that's going to optimize your bond. And we stress this because in the aesthetics industry, there are some products that are used where you want that residue left on after a primer, not this primer, but their systems. And it's different. You have to remember, guys, Onyfix is different. Our primer, the residue, you don't want to keep the residue on, ideally, because it helps optimize the bond. So please differentiate it from other nail products where that residue is desirable and you would like to keep it on instead of wiping it off. So get a little extra optimization tips for you. One last thing, acetone can be used by the client or by you or whomever after an Onyfix application has already been, applied and cured and so on, because you can use acetone to remove regular nail polish from nails that have already had their Onyfix strip applied, right? We just say we mentioned to use caution when using those types of nail lacquers that are like the UV and biogel types that that you need UV light to harden them, because those ones you can't remove the gel or the nail that gel polish or UV polish off without removing the Onyfix strip as well. So you can technically apply a strip of Onyfix to the nail and then apply your UV gel polish over and around it. And even as that nail starts to grow out, you can apply new additional gel polish in the new nail growth after. But be aware that the Onyfix would have to be removed if you have to remove that UV gel. And so make sure your client understands that if they decide that they want to get the gel removed to change the color or whatever. So again, they're not upset about having lost it. Curing time, guys. So again, refinement tips here. What we originally had once upon a time in our original Onyfix video was that the sort of like the little training professional video, about a 5-minute thing, is that we recommend that the primer be cured for about 20 to 30 seconds, and the soft or the hard for maybe about 30 and max 45 seconds. What we've learned over time is that technically could be true. You could cure the primer or the composite that quickly, but only if you have a brand new, fresh battery, never been used before kind of thing, and it still has lots of juice and power. What we've found out over time is that the batteries naturally, like any wear and tear piece of the world, loses power over time. And so the optimal amount of time for your primer curing is 45 seconds. And your soft and your hard about 60 seconds. You don't need more. It's like the primer, more isn't better. If you can't get your Onyfix strip to cure or harden in about 60 seconds, then check your battery, because most of the time it's an issue with the battery. Do also just check to make sure that the strip isn't too thick, because like a big glob of Onyfix would have a hard time curing. The light can't get that deep into thick layers of composite anymore. But number one troubleshooting problem, everybody, check your battery. One thing I will tell you, and listen to what I'm saying, if you're finding that your composites aren't curing well or thoroughly after about 60 seconds, plug your Onyfix light with your cable into your USB port and put a tiny little, do a little troubleshooting test on your own or on a client, whatever, somewhere, do a test, put a glob of Onyfix on, cure it for 60 seconds, and while it's plugged in, if it then cures thoroughly, but it doesn't cure thoroughly when it's not plugged in, then you know that that's your issue. It's time for a new battery. Please check with your Onyfix distributors for a replacement. All right, good. On the note of battery life, I'm going to give you a couple of other very helpful troubleshooting tips. The number one battery maintenance tip I would like for everybody to understand is don't completely drain your battery until it's dead before recharging it. We use lithium-ion batteries, which are like the batteries in our phones, and a lot of people actually don't know this, but your phone lithium-ion battery also doesn't like to be completely discharged until it's dead before you bother plugging it in. lithium, and I can understand why there might be a misconception about this, because there are certain types of, nail drill or e-file systems or other types of batteries in the world where they have a memory, and if you don't totally discharge it first before you bother plugging it in, you're going to lose that little bit of battery memory and your battery dies faster. So I get it, but this is different. Our types of batteries are ones where they love partial charges. So don't let it drain all the way, and also don't overcharge it. That's the same thing here. Don't overcharge it. Never leave your batteries charging overnight. It will burn all the good chemistry up, and your battery will die sooner as well. So we suggest, in order to keep it at that happy partial drainage amount, recharge it roughly about every 10 clients or so, or a couple times a month, 2 to 3 times, 1 to 3 times, depending on how often you're using it, right? Obviously, if you're using it more like every day, do it about the 10 clients or so, or a little bit more often, but that should give you a good frame of reference roughly, because I can already see the engines and the gears turning in some of your minds right now going, when's the last time I plugged in my Onyfix light? And some of you are like, I bought my kit like last year and I've never plugged it in yet, never recharged it, right? So don't wait, do it now, and then do it regularly, okay? Also, just a little reminder, so a good tip, okay? To get you in the habit of recharging it from a partial charge more frequently, in order to lengthen its lifespan, plug it in the first thing in the morning when you get to your office or business, and then unplug it by lunch, whether or not it's ready. And when I say ready, if you look underneath, you see this part where the little cap connects to the light. If you look, it's really hard to see, but if you strain and you lift it, there's a little green or red light. When it's actively charging, it's red, the light is red, but once it's finished charging, that little light turns green. So that means it's ready, you can unplug it. As soon as it turns green, don't let it overcharge, unplug it right away. Or even if lunch has come around and it's still red, don't worry about it, unplug it, because you're gonna forget by the time the end of the day comes, and then it's been charging for like 10 hours. So, and that'll burn it faster. Last little thing, if you're not going to be using your Onyfix light for a while, you're going on vacation or taking a little break or hiatus from work, take the battery out of the light and store it by itself in a Tupperware container with no other metal objects or no other batteries, so it's not touching anything end to end. And that's really going to, and it's stored in a cool, dry place. And whether you're using it actively or not, do you recharge it then at least once every 3 months when not in use? Again, these are tips to help really give it an extra lifespan. Last little bit here, guys, we're getting to the end of the troubleshooting tips, and I'm going to do a couple more slides and we're almost done, so I appreciate your patience. We are doing reasonably well on time. There are 3 things, guys, that you need to be aware of that cause early polymerization. So this is going to help increase the longevity of your composites. The number 1 cause of unexpected early polymerization, so early and quick crusting over before you've even had a chance to harden it, is sunlight. We've had a number of people now, particularly those in either mobile practice working in people's homes with bright windows, or in clinic or other business spaces with large, bright windows. And they're like, I'm applying the Onyfix to the nail and it's actively crusting over and I can't figure out what's going on. And then when we troubleshooted, realized that the massive sunlight is causing the early polymerization, then they would close the blinds and or shield the client's foot and the application from the sunlight. And so you want to be careful of that. If you're finding, do look for that. If you're finding early crusting over, then that it's most likely some type of light, particularly sunlight. Normally regular bulbs of any kind right now don't cause that. So if you're still finding that you have problems, check to see what kinds of light bulbs you have. And if, I don't know, if they're kind of some kind of fancy, very much like sunlight bulbs, then just, try it in a different room or a different space and see if it makes a difference. Number 2 cause of early polymerization is exposure to air or oxygen. So if you've got your tube of hard, we just recommend only only open the tube of hard or the soft when you're ready to, right before you're ready to use it. Slice that bit, like, so turn your knob at the end to take some of the composite out. Slice it flush and flat with the edge of the tube so that there's no dip or depression in the leftover composite that you put the cap back on, because that space with the cap on is going to have air, and you're gonna, that little bit when you use it next time is not going to be as effective. So there's a tip for you there. Your obviously same thing with your soft, take it out, only open it when you're ready to put the cannula on, apply it. Once you're, as soon as you're finished with your application, immediately take your cannula off, throw it out. Don't forget, those are single use only, never meant to be reused. They will destroy your autoclave if you try to autoclave them, and they are not meant to be washed and disinfected. But throw it out, immediately put your cap back onto your soft, and you're good to go. And last thing, although the least worrisome, is your primer. We do typically recommend you just drop one drop into the cap of your primer, to then take your Q-tip or cotton tip applicator and dip it, and that's just enough, and then immediately put your primer back on. We find that the primer can tend to, I guess, evaporate or dry out a little bit earlier, but it's still very robust, shouldn't affect the actual application. It would be more the primer, sorry, the hard and the soft. If it was exposed to sunlight and air. Last thing, same thing, just heat. If you're mobile and it's a billion degrees out in the middle of the summer, and you've got your Onyfix in your car, no good. Carry your store, like transport your Onyfix materials in the car cabin with you, where it's air conditioned, not in the trunk. And try to work with it in places that are only air conditioned. And again, not essential, but a good tip is to keep your Onyfix soft and primer in the fridge. We actually don't really recommend putting the hard composite in the fridge, because that one, again, remember, the colder, the reason for storing this, particularly the soft in the fridge, is to kind of slightly harden it up, right? But the hard itself is already hard enough, and we then find if it's too cold, then it becomes really rather difficult to work with. In that case, you may actually, right before your application, want to just hold it and roll it in your hands for like a minute or so to kind of warm it up and give it a bit of a natural softening. But avoid heat, though, like real heat. All right, guys, very important. I can't stress this enough. Please set your client expectations. What we don't like to hear is when, patients or clients come back and say, well, my distal half strip, fell off after 2 weeks. It doesn't work. Onyfix doesn't work. No, it does work. Onyfix does work. And if it's not work, then it's important that you check the technique. It is, other than an incredibly brittle nail, it is always an application technique thing that needs to be looked at, okay? So set your client expectations. This also means if they are very, very active, okay? They're soccer players and skaters or whatever. You guys, physics is physics. If they've got an Onyfix strip on and they walk 10,000 miles a day and they're skiing and skating or whatever, it's, or swimming long hours every day, 7 days a week kind of thing, the Onyfix strip will fall off sooner. That's to be expected. That's normal. And it's important that you explain that to them so that they're not upset. For example, again, every nail grows at a different rate. But I have had feedback where one client came back to the Onyfix user after 6 months, and it had reached the 2/3 mark, and around that point it fell off. And the client goes, oh, the Onyfix strip fell off, it doesn't work. And I'm like, that's amazing. It stayed on for 2/3 for 6 months. That's great. It's supposed to do that. And if it does fall off around then that's totally fair game. So understand what one full treatment cycle is considered to be. It is fair game if your initial Onyfix composite reaches about 2/3 length up the nail, roughly. It's not not perfect, right? A little bit past half to 2/3 is fair game, okay? Therefore, set your pricing and your application, checkups and maintenance in such a way that you can incorporate a replacement strip earlier if necessary. We often find that if it falls off before the 3 months mark, or certainly well before the halfway, roughly 2/3 mark, then replace it for them for free. It costs peanuts to add an extra one, but you can incorporate your pricing structure for Onyfix accordingly so that you can accommodate that. However, if it gets to about that 2/3 mark and then falls off, that's fair game. That's considered one full treatment cycle that's complete, and you now have to pay for a second treatment cycle. It's kind of like finishing a bottle of medication, and you want to go to the pharmacy and say, oh, I ran out of Tylenol. I demand more that I ran out, so I demand that the second bottle be free. It's like, no, you finished it. It's complete, right? So that's the same idea, okay? And again, set your expectations for the client that very thin and brittle nails may fall off sooner, but the treatment will still work. You'd be amazed at how many people would still love to give that a try before having to, go to other methods. Again, similarly on this is just a reminder about the average client treatment costs. We recommend generally that you charge roughly $75 to $125 per application per toe, with $90 being the average. This goes for basically both Canadian and US dollars. I have here, most businesses will offer a free replacement before the 3 months or 2/3. So it is rare if it's applied correctly though. So if it's falling off early consistently, please do check all various points of your technique, your batteries and so on, to just make sure there's nothing there that can be avoided. And then remember that, again, setting client expectations, it may take 2, 3, possibly even 4 applications for very, very severe cases. But we find the average is 2. If it's just for restoring general nail health, oftentimes even 1 is okay. But just again, so that they understand that it might take 2, 3, 4, whatever it is. And again, because patients and clients don't want surgery, you'll be amazed at how many would still want to try a different option. So ethically speaking, it's important that you at least present the option of a non-surgical solution, rather than say the only thing that we can do is take it out, remove the entire nail. Chances are that you can do Onyfix and help them. And again, you'd be amazed at how many clients will be happy to come. Even let's say it's a permanent chronic condition, they will be happy to come once a year or whatever it is for a maintenance strip, a prevention strip, to prevent long-term congenital disorders and so on, rather than having the entire nail removed or cut. So last things here, guys, we've got very important tips. A lot of you are telling me that you don't know how to sort of get the word out for Onyfix. We know Onyfix is still new, right? Like most people haven't heard of it, certainly not beyond our foot wellness circles. So work with your local general practitioners and family physicians, especially walk-in clinics and community doctors. And I mean, if anyone happens to know or work with or can be connected to other specialists that work with foot care, like those with working with those with diabetes, endocrinologists, wound care specialists, so on. Work with them to let them know what Onyfix is and that you provide this very important service. So create an MD or a doctor's information package. Give them a brochure with your information, your business information stamped on the back. By the way, you can ask your Onyfix distributors for Onyfix brochures. They do have them. and then add a letter as well to the brochure, and or staple your business card or whatever, and give a letter explaining what Onyfix is and invite them to refer patients to you. Because remember that a lot of times doctors, like physicians, will be like MDs, not podiatrists, but MDs will be frontliners for patients going, oh, my toe hurts, what do I do? And they don't know to refer them to you for Onyfix or other treatments unless you introduce the idea. So there's a great tip and information for you. And as we come here to the conclusion, guys, last slide, just bear with me. As a reminder then, what we love about the new Onyfix idea is that it's now known globally as the only all-in-one universal system, a nail correction system for multiple nail dystrophies. Don't forget that other methods that have been out there classically are not necessarily cheaper either. So Onyfix is less expensive than surgery, generally speaking, and Onyfix is also equal or less expensive to other types of corrective methods. And we mention this because time is money. It only takes you about 4 to 6 minutes to apply Onyfix. That's super fast. It could take you, for other types of corrective devices, it can take 30 to 45 minutes to apply. That time is valuable. You could see, 1 to 2 more patients in that time frame. So actually, the $4.50 or whatever it is, a few dollars it's going to cost you to apply a strip is significantly less expensive, considering the astronomical amount of time you're saving by finishing that service quickly and sending them off, versus having to spend upwards of 45 minutes or longer doing other types of corrections. So that's wonderful. Please do keep that in mind. Of course, you now know that you can use Onyfix beyond just the original ingrown and involuted nails. So we've got restoration, onycholytic, reconstruction, surgery, and of course, anecdotal so far just shared through user experience to help with onychomycosis or fungal infections as well. It is revolutionary. There's nothing like it in the world. So be the first in your community to offer this amazing new service, and your clients will love it. Once that word of mouth gets out, it'll take a little while, but it will come back around to benefit you. And there is a need. Remember, there is a need, especially, guys, think of the children and high risk and those with disabilities that either can't get surgeries or aren't good candidates for them, and other people that might be in financial straits and so on. Everybody has challenges, and so remember that this is that solution for them, instead of some other even, like, let's say bathroom surgery, as we like to call it, clients who go home and slice and dice their own nails with nippers. As a reminder, we've got the pricing of each kit in Canadian and US here, but the starter kit comes with 80 applications. That means 40 applications per tube, meaning 80 in total between both of them, and the primer has 80 in total. So 80 overall approximately, which means that your return on revenue can be anywhere from $6,000 to $16,000 per starter kit. That is incredibly helpful revenue for your business. It's okay to survive and pay your bills, and this is an honest way to do it. So this is a great addition. Plus, you are helping so many people in need that didn't have these options before. So just a reminder, we do have our course schedule up there for anyone that needs refreshers or would like to refer someone that hasn't taken the course yet. With that, I would just like to thank you so much for your time. I'm grateful that you stuck with us tonight so that you could learn about these amazing new advances and troubleshooting techniques. And I also just wanted to quickly pop up here the locations available for Onyfix, and certainly Poto Expert as well, for any of you guys that are doing Poto Expert and the UltraMed Hand Expert. We've got Canada, US, and a couple around the world as well, and our list is growing. We're very proud to say. So with that, I thank you one more time, and I will take some questions now in just a moment.